Now, coronavirus infections in South Africa are slowly starting to increase once again. Now, that's according to an actuary who analyzes data on the pandemic's trajectory compiled by the National Institute of Communicable Diseases. Rossouw is head of research and analytics at reinsurance company Genera South Africa, and he's also a member of the COVID-19 Actuaries Response Group. Louis joins us now live to tell us about his model and how he has arrived at this conclusion. A very good evening to you, Mr. Rossouw. Good to have you with us today. Won't you take us through what the current data reveals regarding an increase in cases?
As you mentioned, the cases appear to be increasing in South Africa. To understand this better, we can use the daily reported cases to estimate the reproduction number of the virus, also called R. The reproduction number is the average number of people infected by a single infected person. So reproduction number above 1 means that cases are increasing. For example, if it were 2, it means 1 person is infecting 2 people on average. If the number is below 1, and this is what we want, then new infections are declining. When we estimate the reproduction number, or R, from the cases, there is an underlying assumption that the testing and reporting practices remain stable. If reporting or testing is not stable, our R estimates may be impacted. In South Africa, when we look at the current trends, we see that R came down in the second wave, at the end of the second wave, came down below 1 sort of towards the middle of January, and has been below since. But unfortunately, during March, has been increasing and has recently crossed over 1. This indicates that infections may have started to increase again. At present, it's between 1 and 1.1. R is a leading indicator, so we need to be wary that even if R goes above 1 for a short time, it might not be a big problem. It becomes most concerning if it spends some time above 1. This could result in the epidemic gaining momentum for the third wave. As mentioned, the estimate is also sensitive to reporting and testing changes, so another reason to take time to assess if it stays above 1.
You mentioned the issue of time, and that is quite a huge determinant of whether or not this will become an issue. You said sometime above 1. If it stays sometime above 1, it's a problem. What measure of time are we talking about? Are we talking days, weeks?
Well, maybe in the second wave, R was between 1 and 1.1. From maybe it's crossed above 1 just during September and stayed up between 1 and 1.1 during October. And then in November it went above 1.1, and then we had the sort of peak of R values during December at 1.5. So that gives you a sense of the timing that happened last time, right? In the previous wave. The problem with just trying to copy paste that sort of answer is that things change, right? And the previous wave we had the variant to contend with, which obviously could have impacted R quite a bit. And in this, you know, in the next couple of weeks here, we have things like Easter holidays and back to work and all those kind of things that might be impacting R as well. So it might not be the same again, if you will.
Now, you've described some of the dynamics, but are you able to perhaps tell us if the cases are rising at the same pace, and this is comparing the first and the second wave, and what the dynamics might be moving forward?
Certainly. I think during the first wave, R was well above the current levels, and it would remain high quite until in July. So that was a completely different pattern to what we're seeing at the moment. In this wave, in the last second wave, as I've described, R was at similar levels in October and went up. And as I mentioned, the pattern is unlikely to be the same again.
And in which areas or provinces are the cases rising?
There's a couple of provinces where R has crossed above 1. Perhaps the highest at present is Northern Cape, or one of the highest at present is Northern Cape. R there is in excess of 1.3 and maybe as high as 1.5. That means 1 person is infecting 1.5 persons on average. Or 2 people are infecting 3 on average, if you want to work it out in whole numbers. The data doesn't tell us why. You can't tell from the data why it's happening, but it may be related to a number of cases that were detected in Calvinia, in schools in Calvinia in particular. Some of these schools have been closed down, and many people connected with those schools have been tested. the resultant cases discovered in that way may be causing the rise in Northern Cape, and hopefully that's been brought under control before it spreads into the wider community. In Eastern Cape, cases have also risen sharply. R may be as high as 2 there, which is very concerning. However, we need to note that Eastern Cape currently has some of the lowest number of cases of all provinces. I think it has the lowest number of cases in the last 7 days compared to all the other provinces. So that when cases rise, it is quite volatile. So that might just be a volatility in terms of the high 2 there or the high R there, but it's very concerning if it were to continue. The data, again, does not tell us why. Other provinces that are above 1 currently is Free State, North West, and Western Cape. They're all ranging somewhere between 1 and 1.2. Gauteng also actually went over 1 but dropped back just below 1.
And what are our current preparation levels? You mentioned earlier on that we are about to approach the very busy Easter season, and that time lends itself to some super spreader events. As we go closer to winter, once again, that also is a season that's been highlighted for being, quite dangerous for COVID-19 and the spread thereof. But how prepared are we really for the third wave? And what role does the immunization process play in perhaps curtailing that?
Okay. I'm not really an expert in this field, so I can't really comment on sort of official preparation. I can just comment and say that, given the concern and given the trends and given the time period, it would be great if everybody can take personal responsibility and do their best to stop the spread. So that's kind of my idea on being prepared and being prepared for that. I'm assuming the governments are doing their best as well to understand these outbreaks and to stop them in their tracks. The other side is in terms of the immunization or the vaccination, I guess is what you're talking about, is vaccination won't have as big an impact on the disease, on the course of the disease as yet, mainly because it's just health workers being vaccinated at this stage. That would be, of course, be very valuable in saving our healthcare resources and making sure that our doctors are taken care of during any third wave that we do see. So that would be good to make sure the health system can cope with any demands.
Well, thank you so much for that. Certainly not a time to start relaxing, to still remain vigilant during that time. Thank you for your answers as well as the insight. That was Rossouw, and he's head of research and analytics at Reinsurance Gen Company, and he's also a member of the COVID-19 Actuaries Response Group.